Most people think that heart failure, heart attack, and cardiac arrest are the same thing. They are not. Let me explain. Imagine your heart as a city's water pumping station that has to pump water to every town in the city. Okay, three things can happen. Either the pump can become weak, the pipes can become blocked, or the electricity that powers the pump fails and then the pump stops working altogether. So heart failure is when this pump becomes weak or too stiff to pump enough blood as your body needs. Okay, so patients with heart failure will have symptoms like shortness of breath from blood backing up in the lungs, fluid backing up in the lungs, cough, fatigue, weakness, swelling in the legs and in the feet, etc. This heart itself needs oxygen-rich blood supply, and this supply is delivered by the coronary arteries. Okay, the coronary arteries, the red ones, the coronary arteries. If any one of these arteries become blocked by either a blood clot or plaque, it's going to sever blood supply to that part of the heart. Okay, that part of the heart dies, and that is what we call a heart attack, or medically we will say a myocardial infarction. Myo means muscles. This heart is made up of muscles. Cardia means heart, like heart muscles, and then infarction means death of a tissue. So it means that that part, imagine this coronary artery is blocked, this part of the heart muscle dies, and then the person would usually have symptoms like chest pain, chest tightness that will move to the shoulder, to the jaw, to the back, to the neck. They'll have shortness of breath. In adults and some women, these symptoms are subtle, like they'll have nausea, back pain, and they might not have chest pain. This is actually a medical emergency, and if you're having that kind of symptoms, you should call 911 or go to the nearest hospital, okay, for interventions. I'll do another video to talk about all those interventions. Cardiac arrest is when this heart, okay, that beats every time stops beating altogether. Okay, it's usually preceded by an irregular rhythm like a ventricular fibrillation, and the heart stops beating. Usually the person will not have, not usually, the person will not have a pulse. They'll become unconscious, and they will they'll stop breathing. Okay, for this you would have to start CPR. If you are not trained to do CPR, just start chest compression in the sternum, in the middle of the chest. Deep compressions allow it to recall, to get the heart beating again. So that is the difference between the three.